refers to the care provided to a patient before they undergo a surgical procedure. This care is crucial to ensure the patient's safety, comfort, and readiness for the surgery. Here are some key aspects of preoperative nursing care. Assessment: thoroughly assess the patient's medical history, current health status, allergies, and any potential risks or complications. Perform a physical examination and review diagnostic test results. Patient education: provide the patient with information about the surgical procedure, what to expect before, during, and after surgery, as well as any necessary preparations. This includes explaining fasting guidelines, medication restrictions, and preoperative cleansing procedures. Informed consent: ensure that the patient has given informed consent for the surgery. This involves explaining the procedure, potential risks, benefits, and alternatives. The patient must sign a consent form after understanding and agreeing to the information provided. Preparation: coordinate with the surgical team to ensure that all necessary preoperative preparations are completed. This includes ordering and reviewing laboratory tests, arranging for imaging studies, and ensuring that all required equipment and supplies are ready. Medication management: review the patient's current medications and adjust them as needed according to the surgeon's recommendations. Some medications might need to be stopped or adjusted to reduce the risk of complications. Nutritional status: instruct the patient about fasting guidelines to prevent complications like aspiration during anesthesia. Guidelines usually require the patient to avoid eating or drinking for a certain period before the surgery. Hygiene and skin preparation: instruct the patient on how to properly cleanse their skin using antiseptic solutions. This reduces the risk of surgical site infections. Preoperative testing: ensure that any required preoperative tests, such as blood tests, ECGs, or imaging, are completed before the surgery. Psychological support: address the patient's anxiety, fears, and concerns about the surgery. Provide emotional support and answer any questions they may have. Identification and safety: verify the patient's identity using two unique identifiers, usually name and date of birth, to prevent errors. Confirm any allergies and ensure that the patient wears appropriate identification bands. For line placement, if needed, insert an intravenous line to provide fluids and medications during and after surgery. Preoperative medications: administer any prescribed preoperative medications, such as antibiotics or medications to prevent nausea and vomiting. Preoperative checklist: complete a preoperative checklist to ensure that all necessary tasks and preparations have been carried out. Documentation: thoroughly document all assessments, interventions, medications administered, and conversations with the patient and their family members. Remember, preoperative nursing care aims to optimize the patient's condition and ensure a smooth transition into the surgical setting. Effective communication among healthcare team members and patient-centered care are essential during this phase.